everyone, welcome to Learners Hub Vellore. Hope you're all doing great. Today's session throws light on white blood cells, or you can call it as leukocytes. The leukocyte, leuc means white, cyte means cell. The normal range is about 4,000 to 10,000 white blood cells per milliliter. They are colorless and nucleated formed elements of the blood. Compared to red blood cells, white blood cells are larger in size and they are lesser in number. They play a role in defense mechanism of the body. They act like soldiers and they protect the body from invading organisms. Classification. White blood cells are divided into two, that is granulocyte and agranulocyte. Granulocyte means they contain granules in their cytoplasm. Agranulocyte, they do not contain granules in their cytoplasm. Granulocytes are of three types, that is neutrophil, eosinophil, and basophil. Agranulocyte is of two types, that is lymphocyte and monocyte. Leukocytosis, that is cytosis means increased. Leuko means white blood cell. So increased white blood cell count is leukocytosis. Causes are age, muscular exercise, infection, severe hemorrhage, leukemia, pregnancy, stress, infestation, surgery, tuberculosis, and burns. Now coming to leukopenia. Penia means decreased. Leuko means white blood cell count. So decreased white blood cell count is leukopenia. Causes are bacterial infection, aplasia of bone marrow, anemia, disorder of spleen, malnutrition, viral infection, acute leukemia, protozoal infection, starvation. Coming to the function of WBC. They play a vital role in the defense mechanism. They protect the body from invading organisms or foreign bodies by destroying or inactivating them. In the defense mechanism, each type of white blood cell acts in a different way. Coming to the lifespan. Lifespan of white blood cell ranges from 13 to 20 days. Neutrophils, eosinophils, basophils, monocytes, and lymphocytes. Coming to granulocyte. The first one is neutrophil. Let us see its description. Size is about 10 to 12 μm in diameter. Neutrophils are about 40 to 75% of white blood cells. They are present in blood. Neutrophils have fine pink color granules in cytoplasm. You can see that. Nucleus is divided into 2 to 4 lobes. Lifespan is about 2 to 5 days. Functions, that is,
they are actively motile.
They protect the body against pyogenic infections. They attack the infectious organisms by phagocyte, engulfing, and digest the organism entering the body. They are involved in inflammation reaction. Coming to variation and its conditions. Neutrophilia means increased neutrophil count. Conditions are acute infections, injection of vaccines, metabolic disorders, inflammation, sepsis, seizures, stress, pregnancy, poisoning with drugs and chemicals, and it occurs after acute hemorrhage. Now coming to neutropenia. This is decreased neutrophil count. Conditions are bone marrow disorders, anemia, splenectomy, bacterial infection, tuberculosis, typhoid, autoimmune diseases. Eosinophil. Size is about 10 to 12 μm in diameter. They are about 1 to 6% of WBCs, which is present in blood. They have bilobed spectacle nucleus. They have coarse orange colored granules in cytoplasm. Lifespan is about 7 to 12 days. Functions. They provide defense to the body by acting against parasitic infections and allergic conditions like asthma. They are responsible for detoxification, disintegration, and removal of foreign proteins. They are involved in mild phagocytosis. They provide mucosal immunity. Variations and its conditions. Eosinophilia is increased eosinophilic count. It is due to allergic conditions like asthma, blood parasitism, that is because of malaria and filariasis, intestinal parasitism, scarlet fever. Coming to eosinopenia, decreased eosinophilic count. Conditions are Cushing syndrome, bacterial infections, stress, prolonged administration of drugs like steroids, ACTH, and epinephrine. Coming to basophil, size is 8 to 10 μm in diameter and 0 to 1% of WBC present in the blood. Nucleus may not be clearly seen. They have large, round, deep purple to black color granules. Lifespan is about 12 to 15 days. Functions. They carry histamine in the blood. They are associated with hypersensitivity. They carry heparin and release in the blood. It prevents from blood clotting. They are involved in mild phagocytosis. Basophilia, increased basophil count. Smallpox, chickenpox, polycythemia vera are its conditions. Basopenia, it is decreased basophil count. Conditions are urticaria, that is a skin disorder, stress, prolonged exposure to chemotherapy or radiation therapy. Coming to agranulocyte, they are now let us see about lymphocytes. Lymphocytes are small lymphocyte and large lymphocyte. They are mononuclear cells. They do not contain granules. Small lymphocytes are older cells. They are 7 to 10 μm in diameter. Large lymphocytes are younger cells. They are about 12 to 15 μm in diameter, 20 to 50% of WBC in blood. The nucleus is oval shaped, bean shaped, or kidney shaped, and it occupies the whole of cytoplasm. A rim of cytoplasm may or may not be seen. Lymphocyte has two types. The first one is B lymphocyte, another one is T lymphocyte. B lymphocyte is produced in the bone marrow. It is concerned with humoral immunity. T lymphocyte is produced by the thymus gland. It is concerned with cellular immunity. Lifespan is half to 1 day. Functions are important cells for defense mechanism, mainly for the infectious agents. It produces antibody. It induces immunity for the infectious agents. They are phagocytic. Lymphocytosis is increased lymphocyte count. Its conditions are diphtheria, rickets, syphilis, tuberculosis, lymphocytic leukemia, bacterial infection, infectious hepatitis, mumps, malnutrition. Lymphocytopenia is decreased lymphocyte count. Associated conditions are AIDS, Hodgkin's disease, malnutrition, radiation therapy, steroid administration. Coming to monocyte, they are large mononuclear phagocytic cells which kill and ingest infectious organisms. In tissue, monocyte is known as macrophage. Macro means large and phage is the eater. It is the largest cell in the peripheral blood. Size is about 15 to 30 μm in diameter. Monocytes are 2 to 10% of WBC. They are in the whole blood. The cytoplasm is clear without granules. Nucleus is round, oval, horseshoe-shaped, bean-shaped, or kidney-shaped. The nucleus is placed either in center of the cell or pushed to one side, and a large amount of cytoplasm is seen. Lifespan is about 2 to 5 days. Functions are they phagocyte the infectious organisms. They produce antibodies. They confer immunity. They also secrete an enzyme involved in inflammation. They are also the main sources of pyrogen, that is, which causes rise in body temperature, fever. Monocytosis is nothing but increased monocyte count. Conditions are tuberculosis, syphilis, malaria, kala azar. Monocytopenia is decreased monocyte count. Prolonged use of prednisone, that is an immunosuppressant. Hope you all enjoyed this session. In our next session, God willing, we'll focus on thrombocytes. Thanks for watching. Stay tuned for our latest updates.